So I don't know. I'm just gonna talk about a bunch. I don't know if I'll get everything, but that's gonna be a tough break. Here's the heart, right? And the good blood's coming out of the left side of the heart. It exits the heart through this structure, which we call the arch of the aorta. Previously, you saw that there was a larger and a smaller vessel coming off it going forward. The larger is the brachiocephalic, the smaller is the left subclavian. At this point, the dorsal aorta turns. I mean, it becomes a dorsal aorta as the arch of the aorta turns, and you can see some intercostal arteries coming off it as it goes down. There's intercostal vessels coming off it, like going to the rib area, right? Coming down here, it comes down and it passes through the diaphragm, and now we're in the abdominal pelvic cavity, right? And it's here in the dorsal body wall, like you can see it down here, right? That's dorsal aorta. So there's two kinds of vessels, call it, coming off it, two kinds of arteries. There's median, unpaired vessels going to the gut. So 1, 2, 3 of them come off the dorsal aorta and go to the gut. And then there's a series of paired vessels that come off it, and so there's going to be left and right. Okay? Looking at the paired ones first, this is the kidney. Just in front of the kidney is this little knob right here is the adrenal gland, and there's an artery that's coming off the dorsal aorta on each side. It's called the adrenal lumbar artery. Here, passes by the adrenal gland, and then it ends up in the body wall, so that's called adrenal lumbar. Adrenal lumbar, and next to it is adrenal lumbar vein. Okay? Going to and from the kidney, if we clean up the entrance of the kidney, you'll see there's a vein and there's an artery. So that's going to be renal, artery, and vein. Further down, there's vessels down here. This being a female, you see ovarian artery and vein right there. On the other side, ovarian artery, on the right side, ovarian artery and vein come right off. They come off the dorsal aorta right here, right? And the artery does on the other side. Here's a little something weird. So here's the ovarian artery of the left side. And the ovarian vein is actually, comes off the ovary and goes into the renal vein up here. That's, this little dark band here is actually the ovarian vein of the left side. The ovarian vein of the right side is asymmetric. Notice also that your kidneys are at different positions, right? The right kidney is further up. And so instead of that ovarian vein of the right side going all the way up there, it goes right into these. By the way, what's this big vessel I've been implying is there? That's draining the back of the body. It's receiving these veins I've just identified. It's called the caudal or inferior vena cava. This big one up in the front, we dealt with the other day, I hope you remember, is the anterior superior vena cava or cranial vena cava. Those are all synonyms. Or even if you like, pre-cava, post-cava, caudal vena cava, inferior vena cava, posterior vena cava. Same meaning. Keeping up with the paired ones here, I actually use a slightly different term than your book, so when I'm going to say this, you're going to be like, what? I don't find that one. But I call it just the deep circumflex iliac artery and vein right here. So the artery is going out from the dorsal aorta, and the veins are coming in to the caudal vena cava. Okay. Here, focusing on the arteries, we see this is dorsal aorta. Two vessels come off, and then there's a little bit more dorsal aorta, and then more vessels come off. These first pair to come off are called the external iliacs. And there's a little tiny, much smaller, say the dorsal aorta is now much smaller, and then dorsal aorta completely ends here when you get these internal iliacs coming off. And if we push those out of the way, you can see there's an artery heading down, a third one. So what continues is now called caudal. So this is the caudal artery going onto the tail, internal iliacs and external iliacs. The internal iliacs come and go deep into the leg. External iliacs pass through the body wall right here. And when they pass through the body wall, in the leg itself, what do we call that artery? There it's called femoral. That's the femoral artery, and that's the femoral vein. And a branch going deep right there, like you can see the vein in particular. There's a vein coming right here. This is femoral vein. This is deep femoral vein. And there's a parallel artery in the same location going down there. So that's would be femoral vein going out, and deep femoral going deep. The internal iliac arteries come down here. They give rise to umbilical arteries. That's an example of an umbilical artery, which will come up through the lateral vesical ligament of the bladder. So those are umbilical arteries coming up there. Okay. The median visceral vessels are the ones that go to the gut. The first one is called celiac, and I can get this a little better. I was better at this. So celiac, this is dorsal aorta. This is a celiac artery coming right up here. This is celiac. It's C-O-E-L-I-A-C, not unlike the sound of somebody's intestinal disorder associated with gluten intolerance. That's the celiac. This one that comes off it that heads away deep is called the hepatic. Where's that going? Liver, good. And then what comes off is the left gastric. Here's the stomach, that's left gastric. Left gastric sometimes has more than one branch or more than one version, but we'll call this one the main flow, left gastric. And here's some more left gastric. And then what's left is splenic. The celiac continues as splenic, and this is anterior and posterior splenic, but you can see it going to the spleen. Okay. If we focus on the hepatic here, that's hepatic artery. So again, the flow is dorsal aorta, celiac, hepatic. I'm going to push the viscera to the other side. This is the hepatic right here, and the hepatic comes up, and I don't want to completely destroy everything just at the moment, but hepatic comes up here, and it splits. There's a T right here. There's hepatic comes up, continues to the left into the liver, into the right is something called gastroduodenal. Recall stomach and duodenum is right there. And then here, super great name, that artery and vein right there. You ready? Anterior pancreaticoduodenal artery and vein. So the flow is dorsal aorta, celiac, hepatic, gastroduodenal, anterior pancreaticoduodenal. That's a lot of syllables. And that's the vein, by the way. The vein is draining back. And in this view, none of our cats will be injected, but this vessel, this is a vessel right here. It's not injected. It's called the hepatic portal vein. I mentioned to you in class the other day, hepatic portal vein drains the gut to the liver. Things absorbed by the gut go to the liver for processing and detoxifying. This or the anterior pancreaticoduodenal vein here, for instance, is a tributary coming down to the hepatic portal. The next artery coming off the dorsal aorta right here is cranial mesenteric or superior mesenteric. It's coming up, and it's going to go to various places. One of the places it's going to go is to the colon. And so this is a branch going to the colon right here, left colic. There's a branch of it that comes off and goes to where the ileum and the colon. This is the ileum, this is the colon. Here's a branch going to the ileum and the colon. Anybody want to take a wild guess? It's called the ileocolic. Ileocolic. Okay? Lots of it ends up here going to the intestines. It's going to the intestines. Anybody want to guess the name? Intestinal. Intestinal. One goes to the colon. It's called the colic. One goes to the ileum and the colon. It's called the ileocolic. This goes to the intestines. It's called the intestinal. And one more branch of the cranial or superior mesenteric is it comes up here and it starts to run between the duodenum and the pancreas. It's called the, anybody want to take a wild guess? Posterior pancreaticoduodenal. And those actually connect the anastomose. So you have two supplies through here. Your pancreas is pretty dang important, and it has really good blood supply. Those two ideas go hand in hand. The last of the median visceral vessels in this area is a caudal mesenteric or inferior mesenteric, and it comes onto the colon as another colic. It's got some name. escapes me off the top of my tongue, tip of my tongue. I didn't really review before I started this, and my book is now taken from me by a student who lost his book, but blames me for its loss. Finny. The heart, off the left side of the heart, and these two vessels come off the front of the heart. What were these two called? Big one? Good, brachiocephalic. Smaller one? Which? Give it an adjective. That's right, correct. The left subclavian. And once that happens, you notice the dorsal aorta is now what, with the arch of the aorta becomes the dorsal aorta as it heads down the body and gives off things like intercostals. In that other cat, we pointed out how it came through the diaphragm maybe and it starts feeding the gut. Other things it does in the body is have a series of paired vessels that go to different organs. This is a kidney. Here's an artery going to the kidney, and there's a vein. Together, those are the renal artery and vein. Just in front of them, you see these vessels coming off here. Right in here is the adrenal gland. The kidney and life would tuck right here. Adrenal is on top of the renal, that's adrenal. And the artery and vein right there are the adrenal lumbar artery and vein. They're called adrenal lumbar because they go past the adrenal gland and then into the lumbar musculature. Okay? Some other paired ones going to each side. This is not a paired one, right? This one was called the caudal mesenteric. It's going to the gut here. But paired ones, like if you look at the walls right here of the body, much further down, you see a pair of vessels here and here. Well, that's deep circumflex iliac artery and vein. Or they call them deep ileal circumflex in your book, just to be problematic. Deep ileal circumflex. Okay, there's that dorsal aorta, by the way, that's feeding them. And so other vessels in this area, this one just kind of got ripped apart by me, would be a testicular. Here's the testicular of the other side coming down here. You see artery and vein right there? They're small. They head down the body wall, and they're going to end up coming down here and going in this inguinal canal and out to this testicle down here, for instance. That's the vas deferens coming out of that same canal. We'll come back to that another day. The dorsal aorta splits, external iliacs. A little more dorsal aorta, internal iliacs. No more dorsal aorta. What's left going away from us into the hole is a caudal artery down there going under the tail. External iliacs continue through the body wall. So the body wall is here or here, right? It's going through the body wall. And when it goes through the body wall, now it's onto the leg. What's it on the leg? What's it called? Femoral. Good, good. I knew you were. You knew it. I understand. And this is external iliac, this is femoral, and what's going deep is called, believe it or not, deep femoral. Like there's the deep femoral vein right there, heading deep femoral. Vein here and deep. Femoral veins coming here, deep femoral. Here's femoral artery and deep femoral artery here.
What's that big blue right there? Is that deep femoral?
Here?
Yeah.
It's still called, at this point, external iliac.
Okay.
And it receives a femoral and a deep femoral. This is external iliac artery. It splits into a femoral and a deep femoral. Okay? So we don't deal with anything further down. The internal iliacs go more deeply, right? They're heading here, and they go down a hole there. You can see how it's going down a hole, and associated with it is a vein. So that's going to be, you can see that vein with it. That's going to be the internal iliac vein and internal iliac artery running together. Off the internal iliacs come a little branch here, right there, which comes up actually to the lateral vesical ligaments, and that's called the umbilical artery. There's one on each side. Here's the one on the other side. They're going to come up and feed into the bladder. You notice the bladder has a nice blood supply in it.
That's it?
That's what I can remember. There's going to be a lot. Okay? It's going to hurt your heads. Heart. Heart is, right side of the heart, as we will learn, is pumps out through the pulmonary trunk. It should be generally blue because it's carrying deoxygenated blood. Behind the heart, it splits into a bunch of pulmonary arteries, the evidence of which we can see in the lungs themselves. So you see the blue material, we can call that pulmonary arteries in the lungs. By the way, that hole right there in the lung is a tertiary bronchiole. Tertiary bronchiole. Okay. So the left side of the heart ends up pumping straight out of the top of the heart through the aorta. And this is called the arch of the aorta, where it curves like this, and it curves down behind the lungs on the left side. So that's the dorsal aorta for another day. What's going forward are two vessels. These two vessels, not super good on this cat for some reason, although the later stuff looks good. This is a larger one away from me and a smaller one towards me. This is the brachiocephalic artery and the left subclavian. In a cat, the brachiocephalic, which means arm head, splits or trifurcates. Here's the trifurcation. This is a right subclavian here and a pair of common carotids. Left and right common carotid. Okay, focusing on that left subclavian, and the mirror image would basically occur on the other side. Here's the left subclavian. Here's the first rib. At the level of the first rib, I can find 4 branches coming off it. Okay, I'm pulling on it, and these are small ones. It's hard to see, and I will show it to other people again. This is internal mammary going ventrally, and there's 3 in a row. 1, 2, 3 branches going dorsally. First one vertebral, second one costocervical, third one thyrocervical. Vertebral, costocervical, thyrocervical. Once that happens, the subclavian continues on the arm. Now it's called axillary. It is discontinuous at this juncture now. Not supposed to be. But this is it continuing onto the arm as this axillary. And then axillary bifurcates here. And those are subscapular in the subscapular muscle and brachial onto the arm. Okay, but wait, there's more. Don't go away. I've got more to say. Going up the side of the throat, what's that thing called?
Vagus nerve.
Well, I was talking about blood vessels, but left common carotid. Good, good, good. So left common carotid is coming up the side of each side. So these would be symmetrical. The left side is where they inject, so you can't, the right side is where they inject, so you can't really see much of it. Left side is good for looking, which is why the book is like that. Here's the larynx. At the back of the larynx, this is called cranial thyroid artery, projecting laterally at the same location into the body wall here, muscular. Just in front of that, we see some branching. Some are bigger, some are smaller. This one is my best guess. No, this one. You have multiple. That's what it's going on. These are called laryngeal. Here and here, laryngeal. And the branch coming up here going towards the tongue is going to be lingual. The lingual is running along with the nerve, which happens to be the spinal accessory nerve we looked at before. That's 11. That's the lingual nerve going to the tongue. Once the lingual comes off, we call it external carotid. Cats actually don't have an internal carotid the way we do and most mammals do. That's external carotid. All right, and we get up here, we have some maxillary. External maxillary is right. That's external maxillary here, which is branching. Okay, and the external carotid continues going dorsally around the side of the head. A big branch goes directly underneath the maxilla. Not maxilla, masseter. Right, that's the masseter. And coming off the back is posterior auricular at that point. You see posterior auricular there? And then we went all the way up there into a big hole. We would find a superficial temporal, but we're not going to find superficial temporal. So, common carotid, thyroid, laryngeal, muscular, lingual, external maxillary, external carotid, posterior auricular. Hey, you know what this nerve is? We're next to the common carotid. which we always would also say a number, which is 10. Good. And here, somewhere near this external maxillary, a nerve here, 12 hypoglossal, and again 11 spinal accessory. Fantastic. Your stuff looking in here. See, this looks kind of like it's a blood vessel, but it's not. The 3 median visceral vessels: celiac, superior or cranial mesenteric, and inferior or caudal mesenteric. These are median, meaning in the midline, and they're unpaired. They go to the gut. Celiac, right here, just like the disorder that so hurts for some people in this class, the celiac disease. Here's a branch. Here's a branch coming off the celiac. That's called hepatic. Hepatic is disappearing, going to the other side. Hepatic means it's going to what?
Liver.
That's so right, so right. And after that, we have branches, sometimes they're multiple, left gastric. And then what continues going up is called splenic. And so that's splenic. It actually branches, but this is splenic here. So celiac, hepatic, left gastric, splenic, anterior and posterior splenic. Craniomesenteric here is coming to the intestines. It has a branch that goes right into the intestines, like this branch. So if we look at this, this is the intestine, right? This is the colon, and this is the left colic. This is actually a lesser known one, a less seen, not always this one. This is a middle colic. The craniomesenteric also has a branch coming over right here. This is the ileum and the colon. So this branch right here, if we look at this branch is ileocolic. That was left colic, this is ileocolic. The main flow is coming into the intestines, like the curled up of jejunum and ileum. So vessels you see in here, that's artery and vein together, is intestinal. Intestinal. It goes to the intestines. And one more, well, look, no, there's more than one more. I'm gonna flip everything over, and it is hard to see, and this is not ideal, but I'm showing it to you anyway because I'm doing my best. This is the craniomesenteric. And one more branch of it is here. What's this? This is duodenum. What's next to the duodenum? What's next to the duodenum?
Pancreas.
Pancreas is the correct answer. Pancreas. And the branch coming off of the craniomesenteric going between the duodenum and the pancreas is called the, in this case, posterior pancreatico-duodenal. I wish it was. Hey, let's go back over here though. Hey, what's this one? This is that hepatic from the other side. This is the hepatic right here. Hepatic comes up and it splits. And there are probably better examples in the class, but it splits, and one bit of it is hepatic going this way, and then this is hepatic. It continues to the left and to the right. From my perspective, is called gastroduodenal. Gastroduodenal continues between the duodenum and the pancreas as the anterior, say it with me, pancreatico-duodenal. Posterior pancreaticoduodenal, anterior pancreaticoduodenal, they reach in the middle, they connect to one another. That's called an anastomosis.
What branches off? What branches into the anterior pancreaticoduodenal?
The anterior pancreaticoduodenal receives its blood from the the anterior pancreaticoduodenal receives its blood from the gastroduodenal, which receives blood from the hepatic, which receives its blood from the celiac, which receives its blood from the deep in the back of the body.